Thank you all for coming. I'm Kate Wolin, and I'm the moderator for today's session. Just a reminder, the QR codes are up there to submit questions, and I've got the tablet, so we'll save questions until the end, but happy to have a lot of time for you all to ask questions of our amazing panel. And with that, I'm going to have each of them introduce themselves, starting with Sarah.
Sure. Hello, my name's Sarah Mastroraco, and I lead health at Instacart. And what that means is Instacart Health is an initiative as part of broader Instacart, the leading online grocery delivery platform in North America. We serve over 98% of US households with fresh delivery from 85,000 stores. And Instacart Health's job is to give access to food, both financial and physical access to food. Once you have that access, make healthy choices easier and really combine that into food as medicine.
Hello, my name is Lily Strasser. I am the lead engagement manager at GoFundMe, trusted, proven fundraising platform. Our engagement team is really focused on building on-the-ground partnerships and relationships with both the individuals, organizations, and partners that help serve our communities. Caregiver being one of them, sitting right next to her. So it's beautiful to be here. Thank you, guys.
Thanks. Good afternoon. My name is Tia Newcomer. I'm the CEO of Caregiver. We are a nonprofit online digital health platform that surrounds caregivers with support while they're caring for a loved one that's going through a health journey of any kind.
My name is Michael Lawrence. I run a company called 2Dot with my partner, John Pierce. We operate and invest in mainly digital health tech companies. A little bit different spin on my story. As a lifelong entrepreneur, I had a caregiving company that we were building, software solution, really interesting stuff, but then unfortunately while abroad got very sick. So I have kind of the lens for this discussion of coming from trying to solve the caregiving problem, but also being thrusted immediately into a life and death situation, actually being the loved one when other people were caring for me. So excited to be here.
And can I just add, I forgot, it is November, which also means it's National Caregiving Month. And I would love, actually, if we could just go down and ask everyone, or I would claim that I'm a caregiver, and I would invite you guys, as we are talking about how caregivers show up and how they are overwhelmed, if you think about your own lived experience. We were talking earlier today about mental health, and us sitting here, I think caregiving is about 5 years behind. And what do I mean by that is that if you guys can help tell your own caregiving story, whether you're in it now or you have been, it helps to destigmatize what you go through when you're a caregiver. And we're going to be talking about that, but I'd love to know if anyone else has. And by the way, I'm a caregiver, 2-time cancer survivor husband, and then I have 2 teen daughters that have some mental health issues.
Thanks, Tia. Well, I think that is a great point because caregivers are something we may not think about when we think about behavioral health. And to me, what really stood out was when the Surgeon General's report came out about loneliness in this country. The section on caregivers only referred to parents of young children as the caregivers experiencing loneliness and ignored the behavioral health and mental health challenges that the rest of the caregivers experience. 1 in 5 American is a caregiver, and it's over 20% are caregiving for an adult. So this is not a small population. It's not a rare thing that's happening. And those individuals are experiencing not just physical health, which has historically been the challenges that we tend to focus on when we talk about caregivers, is their physical health challenges. They're more likely to experience early death and chronic conditions, but also the behavioral health challenges. And that's why we're here today, and really grateful for Salome and her team for giving us the opportunity to talk about that. So when we think about that experience and the behavioral health, in addition to the physical health challenges, and of course they're connected, that caregivers experience. Tia, CaringBridge, what you didn't mention, has been around for nearly 30 years. So CaringBridge has seen this caregiver crisis, I will call it, grow in this country. And you mentioned the overwhelm. I mentioned the loneliness. Help the audience understand sort of some of the context from the research that you've done, that you've seen over that time as this platform for caregivers and the patients that they are taking care of.
So we have 27 plus years of people trusting us with their health journeys, and primarily through they're communicating about what's going on with their loved one. And as we hold that data very near. We do not sell it, but we analyzed it. We went in and did some natural language processing. What came to the surface boldly and clearly is that caregivers are overwhelmed. And we then started seeing, isolation and loneliness start with overwhelm. And we know that 40% of the people on our platform are experiencing some sort of emotional impact as they're taking care of that loved one. And it might be a short journey, it might be a long journey. We have all of them on the Caring Bridge platform. One of the things that was very clear also in the data as we looked at it is when a community rallies in support, and that could be emotional support, social support, functional support, that loneliness goes down almost 4 times over a 6-month period. And so just by that community surrounding them with support, and again, it's so simple. It's things that I bet as you guys sit and think about the loved ones or you as a caregiver, financial, food, transportation, all bubbled to the top. And those are the things when I talk to, and a lot of my panelists, we talk about, caregivers know that they need respite. They know that they need to take a break, but they cannot. And I think by us continuing to tell them that is not helpful, but by helping them remove some of those key stressors that around financial, food, and transportation, that really helps them to maybe then have the time to take a look back. And the last thing I'll close with is, I think many people underestimate, or we're starting to talk about it more, but caregivers, unpaid, and I think it's important probably to say unpaid caregivers, are working 40 hours plus a week on top of 30 hours or more of care every single week. So when we're coming at them and overloading them with, you should do this, do that, not helpful. They don't even have capacity to think about, how am I going to get the next meal on the table, or where is that coming from? So I would just invite us to think about that. Overwhelm starts with that very acute things like food, transportation, and other things that we talked about.
I think it's a great lens to think about when we talk about caregiving. Oftentimes we're talking about teaching a caregiver how to be a caregiver, to your point, telling them what to do, and that framing of how can we help take things off their plate and make it easier. And Sarah, it makes me think of something that happens in caregiving. It happens in grief settings as well, which is that people show up and say to the caregiver, tell me what I can do to help. Like, what do you need, right? And it frames for me, as Tia's talking about that can be an overwhelming question. Like, you don't even know where to begin to answer it. So when you think about how you build solutions for those kinds of audiences at Instacart, how do you do things differently so that it's easy for people to bring that food help that Tia mentioned?
Sure, it's a great question, and I'll start by saying Instacart realized that we were a powerful tool, especially during COVID, where overnight we became more of a necessity than a convenience. And when we approached healthcare and caregiving, we come humbly to say, hey, we have this great tool, how can we help? And I think we're listening to people like Tia and Caring Bridge say, and you in your role say, hey, people need help, not like, how can you approach it? So what Instacart's saying is, we have this great technology, and here are ways we think we can help overcome not just time and transportation and like budgeting and stress, but also decision making, right? Which is, I think, what you brought up. And the ways that we do that today are some different tools within the app that people use Instacart differently. So I would say that you can both caregivers use us to take care of others, and then people use us to take care of caregivers, right? So like sending food, for example, there's different ways to do that. We have a tool called Care Carts, which is really just gifting. You can send someone groceries, but then they get a text so they can reschedule it if they want. So right, you are providing food to people based on recommendations. You can provide now restaurant meals through Uber Eats on the Instacart app, but you can provide, you can get ideas from recipes from New York Times. There's lots of content we have. You can share accounts, like an Instacart account with someone via family, so you can build a cart together, which is much better than a, hey, what do you need? I'll send it to you, right? And it can be more than just food. Of course, you have to eat 3 times a day, but you might need toilet paper or paper towels or someone coming to your house. So we've really tried to listen first and understand how our tools can help the situation versus kind of push our products and ideas on people.
Yeah, I love that idea of the recommendations, and it sort of reminds me of being in a caregiving experience, right? And someone being like, I don't need another enchilada casserole, but all these people who needs another enchilada casserole, right? But like to your point, like all these people are stopping by, and we went through toilet paper like at twice the rate my family normally does. And so she was like, the best thing that someone did was to like stop at Costco and bring like Kleenex and toilet paper, right? Because those are paper towels, whatever it was. But it just sort of struck me as those are the ability to take the knowledge you have and make a recommendation to people is really different. And I think really kind of speaks to the right kind of partners and different partners being at the table can really lift that overwhelm for folks.
And then, thanks. And then two other things I want to add. I think we want to lean also to help people with medical diets and necessities. And the two ways they're doing that is we have tags. There's 20 different tags on Instacart. We're continuing to invest in like, this person can only eat gluten-free or low sodium, right? Because if someone has a crisis, there is often a medical diet required. So we're trying to make that easier. And the other thing that I'm doing and my team is doing is actually working with payers and health plans to say, how can we relieve this in advance? And a great example of that is Mount Sinai Solutions has a post-discharge benefit on Instacart. And if you have either had a baby or if you're having a surgery, you get $110 to spend on Instacart to be on healthy food or on baby supplies if you have a baby. And I love that because that's helping both the person and their caretaker, right? You're in advance. That first 30 days post-discharge is so critical. So we're excited about that. We think it's a really innovative way but like easy to address some needs. And we know that's such a critical time, getting released from the hospital.
Yeah. I love that. The other thing that you framed up there is this idea that a lot of times we're focused on, as the caregiver is, on helping the patient. And so Tia talked about this a little bit, is this idea that I like to think of as care circles, right? So, the patient is in the center of that, and they might have a caregiver who lives with them, or the person who sort of assumes primary responsibility for interfacing with the medical team. But there's a group of people around you, right? And that's who shows up on Caring Bridge, or all the people you're giving updates to, right? That you're keeping updated because they wanted to know how my mom is doing. They wanted to know how they could help her when I was a caregiver. And Lily, the thing that I think is really interesting about what you're doing at GoFundMe is another way of helping not just the patient, but also helping the caregiver. And I think it probably speaks to some of what Tia is talking about, that a lot of caregivers are trying to navigate, like, can I stay in my job, right? Having to make a lot of trade-offs. So would love to have you talk about sort of how you guys think about serving both the patient and the caregiver, knowing that our healthcare system is slightly broken when it comes to the cost of care.
Sure is. Absolutely. And obviously, we wish GoFundMe didn't exist in these moments. We wish everyone had what they need, but it does. And we are proud to be there to support people when they need us. Yes, fundraisers ultimately will likely support a patient or someone who is receiving care, but it also can benefit the caregiver themselves. Like you're talking about, those care circles. Anyone within someone's care circle can start a fundraiser on behalf of that caregiver. You can take that burden away from that caregiver immediately. The money can still go directly to that caregiver's bank account. We have a full process on the back end, but you as someone in that care community can step up to take that small burden off of that person. Obviously, we know financial stress is a massive reason for this overwhelm. So you can start a GoFundMe for those transportation costs, medical bills, food, a family outing so that they can have time to be together. You can do that small step to build that for them and kind of take that piece off of their plate. The other part that I love, and as a caregiver myself was a huge benefit to me, is seeing this community form. Very similar to how that community forms on Caring Bridge. On GoFundMe, every donation is an act of care. Every comment, every person sharing that fundraiser is someone stepping up to show support for the caregiver as well. And even just being able to sit back and see this community that's forming around you. Maybe it's your neighbors, maybe it's your coworkers, maybe it's people that you had no idea knew what your situation was, but they're stepping up to show some form of support. That can help build into that care circle, that lessening that loneliness epidemic that we're feeling. So even just in those simple acts, we can make a really big difference on the caregiver themselves. I think the other piece of what we're doing that is really interesting is GoFundMe itself is just a platform full of stories of really incredible humans at the end of the day. And one of the things as a company that we really wanted to do is to step up and validate the stories of these caregivers, recognize the work that they're doing. And so we're doing our job behind the scenes to find these, to amplify them, to share them with folks that we think can help elevate the work that they're doing to keep showing up for them and making sure that they're seen as well.
You're saying that reminds me of some research that came out of the University of Minnesota, right, around sort of how do people feel supported as a caregiver, and the idea that it doesn't have to be the enchilada casserole or a big act, but just sort of I'm old, Facebook right? This like someone, even a small donation, right? It doesn't have to be a big donation on GoFundMe, but these small acts it was love a qualitative and a quantitative research study, nerdy me. But in the qualitative, it was sort of this idea of like, I feel seen, right, by someone doing these small gestures, and that I don't feel like because I didn't make it to bowling or didn't make it to bridge club or whatever the thing is because I'm caretaking, that I'm not forgotten, right? That people felt seen. And so that it makes it, I think it's an interesting idea of how these opportunities for small gestures can make someone not feel forgotten, which I think is an important part of that too. Michael, you're gonna get double because you ran a caregiving company and have been you're the patient part of this. But we talked about sort of the financial challenges, and I know, right, when we think about caregiving, many of the people who are patients are being cared for have very complex care, and the caregiver is suddenly thrown into this, like, become a healthcare professional overnight, which is certainly overwhelming. So when you were building, and thinking about how to solve for that part and how do you interface with the healthcare system, how did you think about sort of helping caregivers have the right information and helping manage some of that medical side without overwhelming them and expecting them to have gone to medical school residency and fellowship in the 24 hours since diagnosis?
It's a super complicated question.
Yeah, I know. Sorry, the easy ones.
First of all, if you're going to get sick, quickly run to London. You're fine. A, you'll hopefully survive, and then B, you'll have no bill. So you're good. There's no financial strain. In all seriousness, the way that we approached it, you were asking a few different things. I think on the financial side, so caregiving is going to be and is becoming an epidemic for employers. Just hands down. Are we familiar with AMA's burden score that we keep talking about? So things like distance, severity, all of these things play in, which plays into heightened levels of burden, which the longer that this was kind of our thesis, that you're in that heightened state of burden, the more likely you are to have financial strain, the more likely you are to quit your job, more likely you are to develop chronic diseases, all led by behavioral health challenges at the same time, right? So we talk about isolation and everything else. So it's a really, really complex question. Everybody is different. One of the things that we were trying to do was we actually sourced on our platform and procured hundreds and hundreds of pieces of information that were vetted for clinical reasons, for efficacy reasons, for just general awareness, to try to alleviate the knowledge gap a little bit, and to alleviate just going to Google and trying to decipher your own information and pretending like you're a doctor and then have the wrong issues. Additionally, we created really simple tools that people loved, like just safe storage places for information. So as you're thrusted into a situation like I was, to weave in my story, and you're sitting there and going, okay, this is happening, where do you take notes? Where do you store information? Especially if you're a little bit further removed than maybe a partner, maybe it's a loved one or somebody further, a little bit more distant, if you will. Just having a place to be able to store all the information that you can actually track. What's interesting is all these situations are really complex, but there's a lot of similarities. So we talked about care circles, just to touch on those. Having individuals in your network that could alleviate some of that burden by, we were looking at Instacart Health. I wish I would have known you. A year and a half ago, we would have partnered because we were looking at finding loved ones to alleviate some of that burden, to alleviate some of the financial stress. So maybe they could cook an enchilada meal or 2 or 3, but on the days that you had to be at a child's event or you had a work presentation going on or a work trip, Instacart or somebody else was there to fulfill it. What's amazing is now with AI, we can start to alleviate some of these things like loneliness. We can alleviate some of the things like if my aunt can't take my grandma to dialysis, I can ask for transportation, and AI can program that for me and send a car. There's so much that we can start to do that because it's so complex, we can start to hone in. But on the financial literacy part, I think it's really a couple of things. I think it's getting, you're starting to see federal support. You saw that a couple of years ago in California, and it's spreading throughout the country. You're starting to see employers support, like I said, understanding that this is a growing problem, actually support caregivers. I think that needs to continue to happen, both in supporting the platform to alleviate some of the financial burden. Again, we were trying to alleviate some of the stress, but through alleviating some of the stress, it was also the financial stress. As Tia mentioned, most caregivers are, $3,000 out of pocket per year. It's significant for most people, and that's just the starting point. So the more that we could actually help facilitate affordable options for them, whether it's from a loved one or from our partners, knowing kind of these top tier issues that came out through our research, we could actually keep people employed. Employers are happy, they're financially in a better position, their burden goes down, right? So their stress level goes down from a caregiving perspective. And at the same time, weaving in my story as a loved one at that time, somebody who was deathly ill, I got better care, better support because everybody was more engaged, and frankly, there was more people better engaged. So again, super complicated question, but I think, and obviously really biased as the tech person, but there's a lot that we can start to do to alleviate loneliness, financial, the literacy piece, all of that. But again, I think it's going to have to either happen from the federal government, health plans, employers, or from nonprofits supporting as well.
Yeah, I think the piece that sort of stands out to me, and I think it's come up a couple other times, is the healthcare is complex. Care journeys are really complex for patient and the caregiver, and there's lots of opportunity to connect people with the right information. But if we throw too much at people, we actually risk exacerbating the overwhelm. So Tia, I know CaringBridge has done some research on sort of when people find you and, could they have found you earlier? And I think, sort of thinking about that and the caregiver journey, would it be helpful if we found people earlier and the health system could connect them to resources? Or how do you think about sort of getting people connected to the right thing at the right time? This sort of strikes me like diagnosis is this time where everybody shows up and says, how can I help, right? But care journeys can last sometimes a few months, but sometimes years, and there's needs along that journey.
Yeah, so CaringBridge, I have to say, our founder, Sana Maring, and I always like to say this, Mark Zuckerberg was 13. I share that because she truly created the first social media platform for good, and she gets zero credit for it. So every time I have a chance, I talk about it because it's just an important piece. The reason I share that as well is, in 1997, she had that acute moment where she was supporting her best friend who had a baby in NICU who eventually actually passed 7 days later, but she had the job as a best friend to call everyone that was asking what was going on. And she, woman of STEM, entrepreneur, she's like, there's got to be a better way, and went downstairs to her basement and coded the first CaringBridge. So when you ask, where is this point of inflection? It is after diagnoses, but in the, I'm not going to name it, it's within the hours or 24 hours of that moment, that critical moment that people start getting overwhelmed. First, they're overwhelmed with the diagnoses or the incident that happened. Then they're overwhelmed with the community that is showing up in all the good ways, but they don't know how to handle it. And so how do you, harness that and enable it, but in a way that's not overwhelming? So I always say that CaringBridge serendipitously is the tip of the spear, meaning that most people say, my first point of overwhelm is after the diagnoses and I'm absorbing everything, is my community wants to help me, and I'm like, I can't handle this right now. So that's I think when we think about healthcare, right, that's the tip of the spear. But then when you have discharge or you have long stays in hospital settings, healthcare doesn't see the things that, I always call it the messy middle, that's not happening in the room in the hospital or the healthcare system, right? It's the messy middle that's either happening at home, in between the caregiver coming and sitting alongside their person that's going through a health journey. And that's where I think communities see that, and so the power is, how do you rally the community in support around that caregiver? The other thing that reminds me of your question is, I think we should all leave this room and remember that care is hyper-localized. I'm not probably sharing anything that you don't know, but that's important, which also means that there's not a one-stop shop, and it's going to be hard to have that. But communities are the places where actually you see they can start giving not only aggregated, here's how I can help, but also how do we, as we're talking about digital health tech, how do we almost reverse engineer what's happening in healthcare? Meaning, right now you get a list, right? So you're in discharge, many of you have been there, you get this list, here's what you need before your person can be released to home, and then that's when the medical degree kicks in that you don't have, and you have to figure out all the things that you have to do. But that list is long, and oftentimes those resources take time to vet through. And so there's a lot of good work that I've been talking to some startups that are reverse engineering and starting to comb, for example, take a Caring Bridge page. Imagine as someone's communicating out, it's picking up on tone, sentiment, things that they might need, and instead of giving them the list, it's teeing up things that that AI may be picking up, natural language processing on what they may need. So it almost is combing that, it's almost doing the work behind the scenes and offering up a narrowed list versus the 100-page lists that you might see.
Can I just add, Tia's spot on. So what we saw was if we can't engage somebody, and caregivers are super hard to engage with, because how many people in this room identify as a caregiver? It probably is almost everybody in some way, shape, or form, right? The problem is there wasn't the awareness like anxiety, depression had maybe 15 years ago, right? Celebrities coming out, us all talking about it, conferences being made, but that's starting to change. And so what's interesting is we just accept ourselves as fathers or uncles or cousins, and so we start to act within that 48 hours. So one, they're hard to communicate to, hard to message to, and hard to engage with. Number two is they're just going to go into action mode. So they're going to Google, they're going to start lining up meal trains, talking to people. And by that time, they're sort of already starting to cope and figure it out, but probably figure out in the wrong way that, again, leads to this vicious cycle, as I used to call it, of, within the first week or so, this depression starts to set in, anxiety starts to set in, that then leads to coping with food, alcohol, chronic diseases start to form months later. We have to find a way to stop it, and to have programs and tools and support in place at that 24 to 48 hour mark, a trusted source to be able to go to change that trajectory.
Yeah.
So,
I think one of the things you said that's interesting is sort of how do you find the caregivers? And we had a conversation with a health plan around sort of there's a lot of things where caregivers are important in terms of medication dosing, medication titration, getting patients to their next follow-up appointment, right? Getting them to the right appointment so they don't end up in the emergency department, which has a higher cost of care. You, healthcare system, should care about all of those things. And they were like, yeah, we don't have any way of identifying who the caregiver is. It's not in the EMR.
and nobody wants to self-identify.
Right,
So
or it's just it
right.
can take time until you self-identify as the caregiver, and sort of the language you use to do that could be really interesting. So, Sarah, I'm thinking you guys have these health system partnerships, but they tend to focus on the patient, right, at discharge. And I'm curious if you have thoughts on, sort of how do we tell this narrative, or are there things that you've heard in those conversations that kind of point to the fact that, we're all patient-centric and the caregiver is patient-centric, but that only allows us to address a piece of this puzzle that we're talking about.
Yeah, it's a great question, and I think I can't solve that question, but I'll add that why I think we're resonating a little bit is, and why we resonate with healthcare partners, health systems, and payers is because we're a consumer trusted brand, and I don't take that lightly. I think that people, you're like, hey, sign up here. I'm like, I've never heard of that in my life. Good luck. I'm not putting my email address, or you're not having my phone number. But if it's hey, here's $100, no strings attached, you can spend it on Instacart for healthy food, the engagement is extremely high. So I think as far as engagement, and you can hand it to the caregiver, so then that person can say, hey, can you order for me? It's just a code. It's like giving someone a gift card, but better, basically, and more trackable. And then whoever paid for it got to see Well, the person opted in to share their email address, share exactly what they purchased with that too. So there is a kind of a loop to say, hey, I provided this and people actually used it. I only have to pay for it if someone used it. So I think that is a way to say, did this work? Did I actually engage? And only pay for it if they actually engage. So we are seeing that, and we're learning that, you know, it improves health outcomes and improves engagement when you use food, and specifically Instacart, because it's a trusted brand as part of it. So I think we're one part of we can be a part of solution, but we're not not the whole solution.
Yeah, I was going to jump in because I too cannot solve this problem, but I think that's why we all exist in this ecosystem, and we find partners and we work together to solve things. So yes, maybe I don't know where all of these caregivers are, but you know who knows where a lot of them are? Tia and Caring Bridge. So we built integrations that are going to meet these caregivers where they are, make their lives easier. Our partnership works in a way where someone sets up a Caring Bridge, GoFundMe is offered there if they want to leverage it. It's already there existing where they can tap into it if they need it, don't have to if they want to, but it's starting to build those partnerships and those networks where we can meet them. So maybe they don't all self-identify in one spot, but maybe they do over here, and we're slowly building those roads to ultimately, hopefully someday it's a lot easier, but we're only gonna get there if we are all working together to start somewhere.
Yeah. I mean, complex problems, right, are rarely solved by someone acting alone. Michael, it makes me think of when you're talking about the employer, right, because employers are payers too, in our self-insured system in the United States, right, and you know, a lot of us, you know, you sort of get like, here are your benefits, and right, it's open enrollment season-ish for a lot of folks, and you don't pay any attention to it because you don't have the need. So when you think about what tech can do to help put the right solution in front of someone at the moment they become a caregiver, like how do you think about that, you know, and sort of that, right, kind of gets back to this, what Tia was talking about, is sort of like, when is the right moment to put something in front of someone?
Yeah, the first thing that we had to figure out is we couldn't be everything to everybody like tech tries to be. Now, with that said, we could get a lot closer with AI. And again, we spent a ton of time doing research going, okay, what are the biggest things that cause the most amount of burden, right? And we took some of the most extreme examples like Alzheimer's and dementia. The mortality rate is abysmal for caregivers, right? And so what we looked at was, how can we come up with not a kind of one size fits all, but a more tailored approach where we can have a suite of partnerships, a suite of tools, and then through, ideally, AI, we can start to, again, match up your individual needs based off of, essentially, one, building trust, two, having value. So again, if we couldn't show value immediately, just like if you ordered food online, right? If you used DoorDash and it showed up 3 hours later, you're gonna be like, this is terrible, right? But if it shows—
You should have used Instacart.
I am agnostic. I'm a tech guy, so maybe we went with DoorDash in this example. I'm sorry. No, fine. We went with Instacart, and it showed up in 10 minutes. DoorDash was an hour. There you go. But the idea is that we can show value as quickly as possible and create that engagement. I was talking to Tia about kind of the value triangle. You talked about employers. If employers can see heightened levels of productivity, obviously less individuals quitting or opting out of the workforce, that's a plus to them. Clearly, because we're in health tech, if we can lower healthcare costs across the board, whether it's long stays with chronic diseases or hospitalizations, heart attacks are tremendous in this space, a ton of heart attacks, unfortunately. There's a large amount of issues that I think tech can solve through that customization. If you can get that value triangle with the individual, the caregiver saying, okay, this is either taking something off my plate, giving me time or money back, I'm a better caregiver, it's good for the system, it's good for the employer, and at the same time, the loved one, as I mentioned earlier, like when I was in those shoes, I was getting kind of that wraparound care, and I was actually having engaged loved ones, care circles around me at the same time, so it was beneficial to me as well. But again, I think I've said this like 5 times. I think the employers are going to be key to this and actually designing a benefit plan that is specific to caregivers. And it doesn't have to be one solution like we were trying to do and then customize it, but maybe a suite of solutions. And of course, Instacart has to be one of those, obviously.
Thank you. And if I can add also, not just the snarky comment, but a productive one. It's speaking of partnerships, what we launched in March is something called the Instacart Developer Platform. So it's so anyone can use we know what's on every shelf in America almost, like literally in every grocery store. And now we have open APIs so that a company can make their advice shoppable. So today it's New York Times Cooking. Any recipe in the New York Times Cooking app, you can click and it'll create a cart on Instacart. If you have Weight Watchers and they have a meal plan, you can add 32 items in one cart based on your zip code and the store that you want within that zip code. And I think that's true when we're getting really, really close to on working with healthcare partners too. There's a lot of pent up demand there for registered dietitians. Here is your meal plan. It is not a pamphlet that goes in the floor of your car, right? Or it's not a like, sure, I'll try this, right? It's very actionable advice that I think is very appropriate for caregivers, right? And anybody, and honestly the patient who can actually take care of themselves a little bit more sometimes too and alleviate their care circle.
Yeah, I mean, what I love about that is not just that it's a plug for Instacart, but Michael was saying giving time, right, and money back to the caregiver and not having to, right, it's just like, I know when I do the New York Times shopping, right, it's just sort of, it takes time to write that whole list, right, or to think about like, you know, to read through all of the ingredient lists to make sure something is gluten-free and it fits in the new medical diet for the person I'm caregiving for. And it makes me think of one of the questions here is sort of the challenges unique to caregivers. And Tia, I know in the research at Caring Bridge that I'm fortunate to, but also that you've been doing for a long time is, you know, the loneliness and isolation that caregivers experience is different than the general isolation and loneliness, right? Because some of it is self-imposed as a function of this. And there's one of the things we haven't talked about with caregiver mental health is that there are positive sides to caregiving as well, right? And so they feel a sense of purpose by doing this caregiving tasks, and that purpose may lead them to choose not to go out and engage socially, right? Which contributes to the isolation. And just to clarify, as the nerd in the room, right? The isolation and loneliness are different because you can be in a room full of people and feel lonely, and the isolation from a scientific research perspective is actually the physical isolation. So when we think about giving time and money back to caregivers, it is that respite, it is that, you know, if it only takes me 30 minutes to do the grocery shopping instead of an hour and 30 minutes, that's time back to do something else. So when you think about sort of that behavioral health part of the caregiver experience, like what stands out to you as the places where, right, we've talked about a bunch of the partnerships that are valuable, the partners that you would like to see come to the table that could also contribute to helping?
I love that question because I was sitting here hearing us talk and thinking to myself, notice that this isn't point solution fatigue, and that I think we have to think about, because the reason why we're focusing on those SDOH of financial, food, and transportation is because if you start putting everything out there, all of the solutions, it creates that overwhelm. And so I do think that, you know, as we think about the collaborations and who else we need at the table, I almost look at it as your value triangle, maybe a little, I'm going to fill in the value triangle differently. There you go. I'm going to do triangle. So you've got to have the nonprofit at the table, you've got to have government agencies, and you've got to have the for-profit / health system. Maybe it is four, maybe it is a square.
Depends on the analogy or
there you go. That is the square value. I don't know.
We'll go with the square this time.
Yeah, but I think here's what I would encourage us to think about. A movement only happens when you have those 4 or 3 entities at a table. It doesn't happen with one. Health systems, for-profit, aren't going to drive the change. Startups aren't alone going to drive the change. So your specific question is, what other people do we need at the table? Here's my wish. We all are looking at outcomes that today we are not tying to an individual, because payers are like, caregiver, it's interesting, and yeah, I know it's important. Oh, by the way, it drives 88% better outcomes and 56% less readmission rates. But until we can bring that value equation back to the hospital system from a profitability metric and some of the other top problems they have, we're still out here fighting the good fight, knowing that caregivers need this support, and by the way, the patients do. Again, I'll go back to that 88% better outcomes. So my wish is that payers come to the table without a price to pay so that we can prove the outcomes at an individual but also an aggregate level down to different populations. And I'll go back to that last point that caregiving is hyper-localized. We don't understand enough by region. by a specific city yet around what caregivers are experiencing differently, whether you're rural setting, zip code level, and that is something that we can only look at if payers allow us to have some of that data that currently is, I'm going to call it a pay to play, but I'll leave it at that.
Yeah, I think it's a great point. So we've talked about isolation, loneliness, we talked about overwhelm. Are there other parts of sort of behavioral mental health that, as you all have interacted with caregiving organizations and caregivers, that we haven't specifically talked about, right? We sort of live in a time where people are stressed, people experience a number of behavioral health challenges, and things that are either like isolation, loneliness, experienced differently by caregivers, or that sort of get overlooked, and maybe, if there are specific, we talk about caregivers, I'm talking about them as if they're a unified whole, and they are very, very different, right? It can mean a parent caring for a kid who is sick. Tia and I were chatting with someone whose family just created a caregiving page because their kid had a traumatic brain injury. We know there are people who are caring for a veteran who has PTSD, right? This is not a unified experience. So are there things we haven't talked about in the caregiver behavioral health that we think we should, Michael?
Just to double click on kind of the loneliness piece, I just want to add, and this crosses both aisles of my experiences, when you're so busy being a caregiver, you're literally living day by day. So if we can give back a little bit of time, and ideally a little bit more time, that quality of time that you're spending with that loved one, whether it's end of life or through an illness, goes up that much more, which again, you tell me the research, but that just leads to better outcomes, that just leads to better situations for the caregiver as well. So, as much as we've talked about the financial piece, I actually think it's the time and isolation piece for both the caregiver and the loved one that is the biggest factor to reducing anxiety, depression, all these kind of conflated issues that you end up having, which then I call it the waterfall, leads to all these other challenges. So again, if we as a collective society, and by the way, like, this issue doesn't happen in a lot of other countries, right? Like, we actually take the time to support our aging loved ones. We actually live closer to each other. We actually spend more time as a family unit. So some of these things that we're talking about aren't actually new. Like, we're caught up in our current society. And so again, if you looked at other countries and said, if I could just have a little bit more quality time that's not on our phones, that's cooking a meal, or doing something together, again, I think you would see our outcomes just exponentially grow. And whether that's solved through technology or employers or time or health plans, like, I think that's something at the core that we need to think about, because that probably rolls into a lot of the behavioral health issues.
So that posed me to ask a question to all of you, because you all have technology platforms that help patients and their caregivers, and many in the audience raised their hand about being a caregiver. I would say everyone in the room probably knows someone who is a caregiver, and technology has an opportunity to allow us to support a patient and a caregiver that we may not live near, right? So if you had one recommendation for the audience about what they could do to support the caregivers in their lives and their behavioral and mental health challenges, what would you say that everyone could go out and do tonight to support the caregivers in their network?
I can start with, there's a saying that is, if you've met one caregiver, you've met one caregiver. So honor that unique individual journey, and I would leave you with, you already said it, but I want to, because I even find myself, even as the CEO of Caring Bridge, when someone reaches out to me with a health event and I want to immediately go, how can I help? That's the wrong thing to say. And so I think the specificity of what you can do, I'm going to be by at this time to do fill in the blank, is the most helpful thing that we as a community can show up for caregivers. So honor the unique journey and just show up with something specific.
I can jump in. I think similar, just recognizing individuals as caregivers. I raised my hand as being a caregiver. I didn't realize I was a caregiver until I was on a plane to go take care of my mom when she was in the ICU. And I realized I'm an only child. She's not married anymore. I am the caregiver. And so until I recognized myself as a caregiver, I didn't understand the depth that that was there. So I think even just recognizing all of the different facets of caregivers, who they might look like, what they might do, that was huge for me once I was able to internally comprehend that. And I think that helps me in my job now, but it also helps me be a better individual in showing up for my mom too.
I'll take it a little broader, but when I think of Instacart Health, I'm not thinking about caregiving all the time. It's very important to us, but what I am thinking about all the time is access to nutritious foods, and 1 in 8 Americans does not have access to nutritious foods, and that's a very high overlap with caregiving. So like my, I guess, advice to you, especially as clinicians or when you're thinking about patients that are coming in, to try to screen for that and be able to help, right? Help with resources, because that's the basis of Instacart Health is.
So you're hating on my enchilada casserole, Sarah?
Your enchilada casserole is great. It sounds like you have access to food. That's nutritious, though. There's definitely nutritious value. But I think when we think about social drivers of health and nutrition being one, that person could be nutrition insecure beforehand, right? And there's a problem that's not just them; it's likely their whole circle. So I think it's really important to identify people in your life, be it in your professional life or in your personal life, that do have access problems, and try to be able to support them with government assistance or with community-based organizations. There are resources out there to help.
I think ask for help. There's actually a tremendous amount of support out there. I think often it just is shouldered by typically one individual, and I think that leads to a lot of the issues or the challenges that we spoke to during this discussion. I think the more that we can talk about this subject, the more, again, just like other behavioral health challenges, the more that we'll be able to solve the issue, more good will come out of it. But we have to be able to talk about it first, and that, several years ago to today hasn't been happening. It's starting to happen, but I think the more we can talk about it, the more we can ask for help.
Thank you all. Join me in thanking our panel, and thank you all for being here.